Okay, we're live. Hello,
Yeah.
everybody. I know everybody's been waiting for us. We were having some technical difficulties, but we are here. Just more excitement until it starts. So let us see. Make sure that this, okay, they can't, it's just telling me that they cannot show it on Instagram again. So let's save this. Welcome, everyone. We're so excited to be here on a Friday night in the States. In Singapore, it's already in the future, Saturday morning. We are here with Dr. Cheu from Singapore. Everybody knows who he is. We're so excited to have him. And I'm going to go ahead and start with his introduction. So Dr. Weng is the clinical director of DP Dental in Kovan and Orchard in Singapore. He completed his BDS, his dental degree, at the National University of Singapore. Dr. Yu received an annual scholarship award from the Pierre Pochard Academy Foundation. He has been elected as a fellow of the Royal Australasian College of Dental Surgeons, fellow of the International College of Dentists. He is the editor of the International Journal of Orofacial Myology and Myofunctional Therapy with the IAOM. He has also obtained his membership of the Joint Dental Faculties of the Royal College of Surgeons in England. Dr. Yu has completed the full TMD continuum at Occlusion Connections in the USA and finished his mini residency on dental medicine with Tufts University School of Dental Medicine and continues to lecture and conduct hands-on courses locally and internationally. Hello, Dr. Yu, and thank you so much for being here. Would you share with our listeners a little bit how you got into airway dentistry first?
I think it stems from the fact that I need to solve my own problem, right? Yeah. So I'm born with a tongue tie. I can't breastfeed. I grind my teeth a lot. Have neck, hip problem at age of 31 to 37. Really creating a lot of issues. So I think the opening is really when I approached Dr. Clayton Chan in Occlusion Connections to have a look at my problem. And of course, taking his courses over a 4-year period, that really helped me to consolidate the whole connection of the mouth to the body, right? And while going through that, Dr. Herman Ramirez appeared in my life also in 2015. That he himself also in Singapore, and really gave me a lot of information regarding oral function, the oral functional myology of the mouth and its connection as well. So that started me on the journey on really connecting things together in terms of occlusion, in tongue function, and then the tongue really gets to me in 2016 when I took a course with Dr. Marjan Jones in Brisbane for babies. By the time I really need to read up on breastfeeding, and I realized, whoa, all the cranial nerves that I studied in school starts to just dance around me, and I start to see the connection. Yeah, so I say, oh, look, I mean, maybe there's really a lot of truth and value to understand them to help me in my daily life as a dentist, because patients do come to me, they have all kinds of issues with the mouth, with the face, with the head and neck. I think if I can understand this better, it will really help to improve, right, my provisional care for them.
Yes,
So that's how.
I feel like everybody in this field, for some reason, either had all these issues growing up or had a personal relationship with somebody, a child or a grandchild or somebody who had these issues. And we go into this world really just trying to help. Whenever we find out that there's something else that we can do, preventive-wise, to help people grow into who they're supposed to be, to have their optimal health, to be able to breathe and grow well, it is amazing that we are able to grab all of these little tools that we have right in our toolbox and all the different specialties, put them together to really help a child reach optimal health. So we're going today to talk about cranial nerves. And hey, Chris, I see you. We're going to talk about cranial nerves. How do you see the importance of appreciating the cranial nerve functions in relationship to myofunctional therapy?
Yeah. I think over time, trying to understand this, are you getting, sorry, are you getting like awkward sounds when I speak? Is that, or I'll put on the speaker.
Sounding good to me. Everybody, can you guys hear well? If you're having any trouble with the sound, please make a comment for us so we can see.
Is it better now? If I just speak through this?
Perfect. Perfect.
Okay. Right. I think the key thing is that we're looking at the end result, what is working and what is not working in terms of the muscles, right, and also the anatomy that ends with it. But I think the underlying issue, right, is that there's the control of the nerve that really help us to coordinate. So when we look at one section, but there are many nerves running from here to others, right? For example, just stay closing your mouth. So we say facial nerve controlling, but you also have your trigeminal nerve, right, dealing with the jaw, and so there's beyond that just the anatomy of the mouth, but is this whole very intricate synchronized firing of the nerve, so that you don't end up just closing one side, or you want to close your mouth and your jaw still want to open, right? And your neck is like all the way to the side and you're trying to swallow. Yeah, it's all awkward. So how did all this come together? So from the very start, you look at reflexes, maybe like babies. So baby getting a signal from the nipple of the breast. So I need to fire off the accessory nerve, cranial 11, right? So you turn the whole head over, and then you have your facial, your trigeminal nerve, opening up the mouth, ready to latch. And once you get on, then your tongue, your hypoglossal nerve, number 12, will start to do the haloa dance, and then try to just deliver the milk to the back of the throat, glossopharyngeal, vagus, right? Accessory again, trying to make sure everything is all coordinated. Stopping your breathing, coordinating your heart rate, getting your gut ready, and then you start to swallow in a very coordinated way. Suck, swallow, breathe.
Wow.
Suck, swallow,
I hadn't
breathe.
thought about that. All of the cranial nerves that are involved in breastfeeding. The baby, they need to smell. They need to, as much as they can see, they need to turn. This is amazing.
Yes. So the olfactory nerve, right? They have to be active. So they really recognize mommy's scent, and they feel safe, and they're ready to feed. If there's also a certain, difference in terms of maybe temperature, the environment is not right, the baby is now not having that sense of safety, and you can see that then all the reaction is very, very different. So even if you put a baby on the tummy immediately after birth, baby is able to crawl all the way up and then ready to latch on, right? So how did he get his balance, right? The vestibular cochlea. So and even just he doesn't really, or the baby can't really see well, but when the female is ready to breastfeed, the breast, the areola is really darkened. So it's just helping the baby to say, okay, find the target.
The target, yes.
Yeah, find the target. So you can see that really just right from the kick, from the start, right? We really need to depend on all this coordination of cranial nerves in order to just survive, right? And one of the key component that is trying to help us, as one of my colleague, Dr. Patrick Phillips from France, he highlight a lot about swallowing as an important component, and he say that how we practice, right? When we're in the in the womb, right? We're already drinking amniotic fluid.
We're swallowing before we're breathing out here.
Yeah, so we're swallowing. Yeah, so we're swallowing. So we're practicing. You say it's about 50% of the the volume. It's about the amount that we drink the moment we get out. So we're
Wow.
swallowing, we're training, right? And then once we get out, yes, we have to start coordinating, breathing, and suck, swallow, breathe reflex again, right? So when you swallow, you can't breathe. So you actually go into a swallowing apnea, literally, right? So once you swallow, epiglottis closes, and you have to finish that whole process before you open up, catch your breath. So even that very understanding that you need to do this, you can see why some children, they don't swallow well. If they're not able to keep the tongue up and bring the bolus back and really coordinate with the swallowing, the airway has to be partially, or should I say, has to be closed for the time being while they try to swallow. And if they can't complete the whole swallow work quickly, they're holding their breath for quite a while now.
That is
Yeah.
so true.
Yeah. So now, what's the choice, right? Do you continue or do you just catch a breath? But you can't just swallow with, I mean, you can't just start breathing with bolus of food or fluid still there. So you have to like vomit it out, project it out or spit it out. Then you catch your breath.
I
Yeah.
think that's why we teach parents who are bottle feeding to do pace feeding and to make sure that you don't have the bottle on top of the baby. The baby has to be kind of straight in the bottle in front of it so they have full control of what goes in. Think about it. If you have the baby laying down completely and that bottle is on top, they have to swallow. Otherwise, it will choke.
Yeah.
So a lot of times they will give them so much milk. Oh my goodness, they were so hungry. Well, they had to eat it.
So with that, right, they also coordinate this whole swallowing through a very different pattern. You get them not putting the tongue up and swallowing in a very nice quick gulp, but they go tongue thrusting, right? So they have to ration the flow now. So they go, yeah. So then they learn tongue thrusting right from the start, right? So if you put them on a bottle for 2 to 4 years, and then you ask them, why are you like sticking your tongue out? And you're like, who created it? Yeah. So even the Stanford study look at some preterm babies, and if we start them on a bottle early, right, and never switch back to breastfeeding, in just 6 months, right, you get the jaw, the upper palate, shall I say, the palate actually deforming a little, constricting, and the tongue become hypotonic, and low. And some of them do develop sleep disorder breathing. So if we don't look at it early and see the coordination and really act fast, we prep the baby or the child, right, to go into adulthood, having issues. And then we're trying to solve a lot of issues externally, like we discussed before. There's many symptoms, and then we give names to all the symptoms, right? So if we can treat the root issue, right, we may settle a few things much earlier and faster.
Unbelievable. That is amazing. So, cranial nerves. Which ones? We're gonna talk about the vagus a little bit. How important? Why is the vagus getting so much attention now? And why is it so important for myofunctional therapists?
Yeah, I think ultimately we are dealing with human beings, and we're social creatures, right? And the underlying part of us is our autonomic nervous system that is actually primed over thousands and if not millions of years, right? We need that feeling of safety, right? So our autonomic nervous system only acts up well for the parasympathetic to help in your breathing, your immunology, your reproductive, your digestive system, among others, right? So the vagus play a very central role in helping us to achieve that. So the polyvagal theory by Stephen Porges is something that I feel every one of us should be spending some time to really understand. I'm still a student as well, so I don't want to purport that I know it. And it's just that it resonates with me because I feel that he's explaining to us the physiological explanation of our emotional presentation. All right. So when we're not feeling safe, we really can't start living, right? In a sense that your swallow, your facial expression, right? Your breathing, your heart, of course. So everything is all coordinated and linked to it. So when I talk about 12 cranial nerve, and then as when we are dealing with myology, when we're talking about orofacial component, our facial expression also is a translation of our emotion. All right. So you can be calm by looking calm, or you can,
wow,
all right, or you can, like you're excited now, right? Just by changing your
that's
facial
what
expression.
that's what they talk about, auto-regulating ourselves.
Yep. So again, also you coordinate with your people around you, right? So that feedback is so important, and so that's why when we are dealing with all this muscle function, we're not just going in and just train the muscle, just like trying to get the bicep bigger and move the biceps, right? There's a lot of emotion involved. So, and understanding the emotion, understanding how we keep calm, then we hop back to what is really keeping us calm. So what is the first thing of safety in the first place, right? Is that your ability to breathe.
Yeah.
If you can't breathe, you have to breathe faster, your heart rate goes up, you can't be calm. You can't be feeling safe, right? So in all this chaos, everything is changing, right? Your blood pressure, your heart rate, your hormone system, everything is moving. So how do you get to homeostasis? Yeah, so one of the way, right, and one of the most important way is just breathing.
Yes.
Yeah, so you use breathing to overlay this whole component, right, and being able to then regulate heart rate among others, right. Then you go into a calmer state. So you start with that.
And the vagus nerve does all of that. It's
The
helping
vagus
your
nerve.
heart rate.
Yeah, so the vagus nerve has a very extensive ramification. So it innovates like from your throat to your heart, yeah, to your lungs and to your gut, right?
Mm-hmm.
And it connects well into your autonomic nervous system, so that all the nitty gritty in terms of how much hormone, how much secretion for your lacrimal gland, your reproductive system, even your skin, all that is in close harmony in that. So that's why when we treat some of our patient with all this regulating of tongue, swallow, breathing, right, you can see that even the eczema tends to improve a little, right? So that has a very, very big connection too. So and men, if they have sleep disorder breathing, they suffer from erectile dysfunction, right? So there's one of the main reason why they should get them to get some treatment done. So you can see the whole system is that you just think about it, right? If you're ready for war, you're sympathetic high, right? Are you still going to worry about what you're going to eat? Are you going to have babies tonight? Kind of stuff. And even your immune system is not that ideal, is being impacted. Stress hormone high.
Exactly. And the stress that people are going through nowadays, everybody's sympathetic system, I feel like, works way more than the parasympathetic system. And it shouldn't be that way. We really don't have to be running after animals to kill them to eat anymore. We should be using our sympathetic system for all the excitement and the good stuff in life, and not all the stress that we're dealing with.
Correct. We still need that stress or the upregulating of the whole emotion, but like you say, for enjoyment. But we shouldn't be putting ourselves into this whole issue. But a lot of times we use the stress, and it encompasses a lot of things, right? But the other stress that we are really facing now, again related to what we are doing, is oxidative stress. right? Yeah. So oxidative stress is literally, right, your body just not getting enough oxygen to do the whole production of ATP for you, for anyone. So if we don't breathe well during the day, or even just by like now, I'm talking, right? So I'm really excited. But if I want to breathe well, I will be doing this, and we'll have a next conversation in the next. Yeah, nobody want to talk to me anymore, because if I slow down and breathe and talk, so I'm gasping for air. I'm gasping for air while I'm talking.
Mhm.
So that's not so ideal. So if we talk a lot, right?
So
Yeah,
teachers, professions of people that talk all day long, hygienists really talk all day long, and dentists, because the patients, right, can't talk. So you're the one talking.
Exactly. So we should understand that just that. But of course, we can find protected time where really we have to find time to really slow down, right? Not just to say meditate, but really what we're trying to do, clear the mind. What we're trying to do when we say clear the mind. So literally is through just through breathing, and the science has thankfully caught up and explained a lot of this ancient art of healing for us. So if you breathe through your nose and slowly release. So if you lengthen your out breath, yeah, you're actually activating your parasympathetic system more, right? And also when you're breathing through your nose, your inspiration, yeah, it's actually helping to circulate the cranial fluid as well, CSF, right? So and when you breathe through the nose, and compared to breathing through the mouth, right, you actually consolidate your memory much better as well. So again, excuse me.
Bless you.
Yeah, cranial nerve in reaction. Yeah.
Yes.
So
we're demonstrating it also.
Yeah. So true. Yeah. And so when you breathe through, and your memory score gets better. When you're chewing, you're activating your trigeminal, right? Okay. But there's a branch that goes to your dura, the outer layer of your brain. So that's why, when some coaches and some players, they want to react fast, they want to keep thinking about things, they put chewing gum. Yeah, they keep chewing. Yeah, so chewing actually will activate your mind. So
it's so interesting.
yeah, so basically, right, for all that, if we can look at all this, and again also our diaphragm, the diaphragm, we have our breathing, but also you have your phrenic nerve that runs through it, right? So again, so that's why some osteopath and chiropractors, they can help, some digestive, and if they act on the phrenic nerve, which is part of the vagus nerve, right? So yeah, so if you activate that breathing, and then digestive system also is improved. And then when you swallow well, yeah, you touch the back of the throat, activate your swallowing center, start the whole peristaltic movement, right? So again, the vagus, is among all the others, is also playing an important role to regulate your digestive system, sending a signal at least 2,000 times a day, collecting bolus of mucus from your nose through a very good tongue up swallow, right? Yeah, you draw some mucus out from your back of your nose, and you mix it with some saliva. So now you have the most ideal antiseptic, wipe or bolus, right?
Wow.
Yeah, and then you do your proper swallow and start the 2,000 round, right, every single day, right? So this is also helpful in cleaning your gut and rebalancing it. So as all we talk about microbiomes, and again, like I said, the gut health, we must start talking about the swallowing as well.
That is amazing. Somebody says, we give my son chewing gum when he's on virtual school, and his attention has improved so much. How interesting. Something else that you can do is have him tape just a very small, thin piece of tape, or kind of thin, from here to here as he's chewing gum. If he can still do it. Lips closed, that might improve his nasal breathing. Make sure he doesn't open. Very good. Somebody else said, I don't know if this is off topic, but what about nasal breathing in athletes? I've been seeing mixed studies that it doesn't improve performance, and others say it makes it worse because too little air is inhaled.
Yeah, so I think athletes are, or anyone is just not understanding this whole component ideally. Okay, so even the All Blacks and Wallabies and the rugby players in Australia, they tape their mouth to train. Even your SWAT team in US, right? Thanks to Patrick McKeown. Yeah, so he's training all this right breathing technique. Of course, using Buteyko, but also others, right? You know, to optimize the body. He wrote a book on oxygen advantage, but if you read it closely, it's actually carbon dioxide advantage as well, right?
Yeah.
That's right. So it's actually carbon dioxide. That's really helping with the dissociation of your oxygen from your red blood cells through the Ball effect. So if you are able to close, when you're breathing, you're actually breathing. We all have to understand first thing first, right? When you breathe through your mouth, your resistance is reduced by 50%. So when you reduce that resistance, just like you try to inflate a balloon like this. Okay, compared to you breathe through your nose. Yeah, you really can inflate your lungs much better down to the deep lobe. When you're using your nose to breathe, if you know how to do diaphragmatic, right, you're actually opening up your thoracic volume much better, right? And then by concentrating some certain amount of carbon dioxide, you're now increasing the release of oxygen, dissociating, releasing it from your red blood cells, and then the body has more oxygen to work with. So just like some individual going on high altitude training, right? They are facing very scant amount of oxygen in the air, right? Of course, they can train. They still have to slow down their pace first, right? Then you activate the body. Then your erythropoietin from your kidney will start to then produce more red blood cells, and then your oxygen carrying capacity is increased, right? But then if you do the same thing on land, right? Once you want to close your mouth and you want to use your nose, don't do it at the same pace. You kill yourself, right? So you slow it down first and you build. And now because your tongue is up, right, and your breathing is right, you actually manage your heart rate because of the increased parasympathetic tone. So you don't go into high zone. You can keep your heart rate within a certain height, zone, shall I say, and then recovery is much faster. So there are enough studies to prove that it is the case. And in Singapore, our marathon record holder, Coach Rameshon, right? Yeah, he told me, right? I talked to him, and the record is still standing for 22 or maybe even now 24 years now. Yeah, the moment he kept his mouth closed and he ran the whole 42 kilometers, right? That's when he broke the record, and it stood stints. So that is the key.
So a few years ago, and if somebody knows who this runner is, you can please post and let us know who it is. I was watching the qualifiers for the Olympics. It was probably 3 years ago because my daughter was little. And it was just me and her at home. I didn't have anybody to share with, but there were about 25 women running the 10,000 meters. And they started. And there were, of course, so many of them. There was one lady in the middle who had her mouth closed. Only one. She was from Nigeria, if I'm not wrong. Not only did she beat everybody, she beat everybody with 2 laps in front of everybody. I mean, 2 laps ahead of everybody. She was finishing the second lap and people were just finishing the race. It was unbelievable. She kept her mouth closed the whole time, the only one. And when she was done, they interviewed her and she was talking just, a little bit, breathing a little bit heavier than we are right now. I mean, unbelievable. And I'm like showing my daughter, see, I knew she was going to win. No, I can't. But it's incredible. I think it was Patrick McKeown's book that says that high-intensity workout athletes, you can open your mouth about 40% of the time during high-intensity workout. But other than that, if you can keep your lips closed and breathe through your nose, you're going to increase endurance, you're going to increase strength. I do want to ask everybody, the floor is open for questions. Please send us your questions and we will read them over here. Ricky said, chewing gum provides proprioceptive input and helps calm the body. Thank you, Ricky. So it's good for us to know, and myofunctional therapists to know, that it's not only to work certain muscles and work on chewing or lateralization of the tongue, but also provides the input. That's awesome.
If you think about it, right, Renata, chewing takes all 12 cranial nerves to work as well.
Wow.
Yeah. Okay. So you look at it, right? So when you chew, right, you have, when your jaw is moving and when you're chewing, do you have to tell your face what to do? You don't have to, right? It's coordinated. Then do you have to tell your tongue to go left or right, because your food is in the mouth? No, right? No. You'll be talking to your friend. Oh, well, yeah. And then when you're ready, you swallow and then again, right? So you swallow without even thinking about it again, also, right? So that means the facial, the trigeminal, right? The hypoglossal, glossopharyngeal, the vagus, right? And of course, when you're eating, the olfactory will help. If you're looking at your food or at least having some reference, it's easier. If you close the eyes and eat, a bit more challenging. And your neck accessory, right? You don't want to hello. So you also just want to stay still. And
little babies would say your neck needs to be straight up before you can be introduced food. So
yes, exactly, because then it helps in again, everything is coordinated. So even some, you want to open and bite and chew a bigger bolus of food, like you're eating a burger, right?
Mm-hmm.
Right. Okay. So think about it, right? How do you open your mouth wide? Upper and lower jaw. Yes, good. All right. You move your lower jaw. Do you move your upper jaw when you open your mouth wide?
Yeah.
So you do this, right?
All my feelings.
You do this, right?
No judgment, please.
Okay. So that means, right, when you move to open your mouth, you move your trigeminal, open your jaw. And you have to also move your neck.
Mm-hmm.
All right. Your head up. Right? And you can open really wide to get the burger. Right?
Yeah.
Right? Yes. So that means, right, you're actually activating your accessories now to actually move the head. And if you think about it again, that's a fact. Right?
Now I'm looking a little bit.
Can you move your lower jaw?
I can hear you. My lower jaw?
Can you move your upper jaw?
No.
No. Yeah. No. Yeah. Okay.
Oh,
so to move your upper jaw and chew, the head is right.
Can you move your upper jaw a little bit?
So you move your upper jaw by moving your whole head because it's stuck to your whole head.
Yeah.
So your upper jaw starts from here. Okay. Go to the side, bit of underside of your eye, and part of your cheekbone, right? Is your upper jaw is still the maxilla. So the whole maxilla is huge, and runs all the way to the back. So that's why when we put the tongue up and we activate the maxilla while we're chewing and eating and breathing and swallowing and moving, right? This whole mid face will grow. This whole mid face, and it actually expand the whole housing for the nose, right? And that helps in the breathing, definitely.
Wow.
And give you extra cheekbone, right? So that's how you look better as well.
I know we all need expansion over here. Let's see. We have somebody that just said, can we go a little more in depth about how the vagus nerve affects gut biome? Is it because of hormone secretions, acid production?
Okay. Maybe we don't have to get that far and say that the vagus nerve affects the gut biome first. We just talk about mouth breathing and nose breathing. All right.
Okay.
So, of course, a mouth breather, the vagus nerve is not going to work so well, right? Because the tongue is always down, and when the person swallows, the tongue tend to push forward or lateralize, and instead of going to the roof of the mouth and activate the swallowing center, right? So they swallow rather than up and right. Yeah. Okay. So you put that in perspective first. So now we just talk about mouth breathing. Ha ha. Okay. All the time, or just opening the mouth, not even breathing through the mouth, just open mouth, nose breathing. Okay. So that act evaporates a lot of saliva. All right. So your saliva is built pH neutral or slightly alkaline. It's supposed to neutralize the acids in your mouth. So it kills the bacteria. It helps to reduce down the fermentation because it's just keeping things clean. If you open the mouth, they tend to the front teeth. We tend to get a lot of what we call it, the plaque, right? So you can see all the sticky part. So when a child come back in for review, I ask him, "Have you been closing your mouth?" And he said, "Yes." Yeah, and I take a photo and I see all the plaque on it. I said, "Nah, you're bluffing me." Yeah, no, I mean, I know it's not real. Because when they keep their mouth closed, right, you can see a tremendous improvement in terms of the oral hygiene, right? And also because they keep the mouth open. Yeah,
All
exactly.
those patients that we see that have very, very red gums on the front, especially the upper teeth, usually they're mouth breathing at night.
Yes.
So especially if you see somebody that doesn't have a lot of plaque and still has inflammation on the upper anteriors, take a look at mouth breathing.
I think you're right. Yes.
Very good.
You provide a certain bacteria.
I am losing you a little bit.
Sorry.
Are you there?
Can you hear me?
Can everybody hear? Yes, now I can hear you. You froze a little bit. Is it okay for everybody, guys? Can you guys hear as well? Let's see if somebody's going to say something. I'm not sure if that's no. I think it's still going.
Okay. Yeah.
We'll keep going because it's recorded.
So that's when we open the mouth, right? You induce a more acidic environment in the mouth. So you're also bacteria that really like this kind of environment. All right, and then you swallow very irregularly and properly, getting all this saliva. Because you don't breathe through your nose, accumulation of all the mucus that's been there, bacterial infestation and all stuff, and then occasionally post or you suck it in and you swallow all this muck, right? And in a very poorly moving, very poor peristaltic movement because you're not activating the swallowing center and getting the peristalsis move. Right.
Wow.
So you get irritable bowel syndrome kind of stuff, right? And you have this things going in, and because of nighttime, occasionally they have issue of because mouth open, right? Tongue down, airway block at night. You have very laborious breathing, right? Sympathetic tone up, parasympathetic tone down, smooth muscle control. Sphincter of your gut is actually released, loosened. There's a backflow of acids from your stomach back to your esophagus, right? And then, right, all this is happening day in, day out, day in, day out. So you don't really have a very clear and clean gut because of this very poorly coordinated swallow breathing. Right. So if when we start everything well, right, parasympathetic system is strong, vagal tone is strong, right, then your good nasal breathing, get mucus, get the saliva, clean your gut 2,000 times a day. It's a different story altogether now, right?
Wow.
And also, you look at all the peptic ulcers. They're actually created by Helicobacter pylori. So this bacteria, right, really grow very well in very acidic condition. So my point is that, right, we thought that no bacteria can grow inside our gut anymore, but this guy made it, right, and create problems. And also it took this Australian researcher, I forgot his name, sorry, but he drank the the gut juice of another patient, okay, to prove that he can inoculate himself, right? And he won a Nobel Prize for it. Okay, so it's all fine. Okay?
He deserved it.
Yeah, he deserved it. So basically, my point is just that, right? Yeah, it is a situation where we really have to take care of the by eating what is natural, right, first, and then our body will just react accordingly.
Yeah, I guess our internet connection is just not great. I hope that I see some people saying that it's in and out. Some people are saying it's cutting up. So hopefully whenever it records everything super good. So we're hoping. But I can hear you well. Chris just asked us, I wonder how people with UPPP or UPPP are affected with effects, which affects the back of the throat lubrication. So people who have had UPPP, which is that surgery where they cut a little bit of the soft palate and the uvula. It's one of the treatments that used to be done for sleep apnea to open the airway. I actually had not the uvula, but the soft palate removed on both sides a little bit. Not that I wanted it done, but it was done. And since then, I've had trouble swallowing. But I guess she's asking if that affects throat lubrication. What else? There are some little nerves over there that I know help remind your airway to stay open. All of a sudden, they cut that off. How?
Yeah. I think it's a whole barrel receptors, pressure receptors, and all this difference in terms of flow, pressure receptors. So one of the ENT from Malaysia, Dr. Jivanan, also make a very good point to me, and he said that it's not about just removing things, right? It removes the obstruction, but it doesn't create the right pressure. Right, so it's not about just taking. So you still need the correct, architecture in order to allow for laminar flow and also a certain pressure of air in order to breathe well. So I was very, very fortunate. Professor Christian Gubino was in Singapore in 2017, right, to give. He's a keynote speaker for the Singapore Sleep Conference, and he was on stage. He was making critique to every single presenter. So you can see many of the presenters were shaking.
I can only imagine.
And he was very critical about UPPP. Yeah, he said that this is not
well.
And so one of the presenter actually went to the organizer and said that he will present tomorrow after. I think it's all about UPPP, if I'm not wrong.
I feel great.
Yeah. So I'm just saying, right? Even like last year, the Sleep Medicine Journal highlighted that adenoid tonsillectomy, right, 60 to 70% recurrence rate of OSA, short-term divergent, and there's no long-term benefit. So that's why some ENTs are really sitting up and say, hey, look, if this is the case, what can we do? And they are very open to collaboration now. They're sending cases to dentists like us with training in myofunctional, and then we get a whole team to rehabilitate and see where we can go from there before we really cut. So I think this is the future, and also
and it's okay, like you said, we're all learning together. We used to do tracheotomies for sleep apnea. It is 100% success rate, but do people want to be walking around with that? No. Exactly. So we are all learning as long as we all keep researching and keep working together. And that's why I wanted to make a group like this, Airway Circle, so we can spread the word and really get these professionals from all over the place, and let's talk. Let's sit down and have a regular conversation and just share knowledge. And how can we help more people know what all these amazing professionals have been doing, and it's working. Let's sit down and talk about it. It's okay if you're used to extracting 4 premolars and pushing everything back. What do you have to say about that? I mean, it's not okay. I said it's okay if you're, you want to look into it and what can we do differently.
See, right?
I know. I always say, run. They want to extract teeth. Run.
the different norms.
Mm-hmm.
Right? For different racial group and all. Okay. So for Asian, very prone to airway obstruction because of our architecture of the whole airway at the back. So sometimes in US, my colleague was just telling me that the thin Vietnamese is out snoring, the fat American, right? So it doesn't really need to be fat in order to stop the breathing. So because of that, we tend to be more bimaxillary protrusive, right? So upper jaw, lower jaw tend to be just out a bit more. So of course, if we compare it to maybe some of the social norms, it's like we get more Western media kind of influence at like we're getting certain facial features that we achieve. So we go for it, right? So we want to extract some teeth so not to have such protrusive facial form. And we're architecturally, physiologically, we can't reduce the space. And also, if you see, it's very interesting. For Caucasian, sometimes because of that, thin, less protrusive, the lips looks a little bit thinner. So they want to look like Asian with thick lips, or Afro-American, right? So then they have all the fillers and all that.
Is it okay for people to get fillers? Does that affect your lip seal? Do you think it affects myofunctional therapy or lip seal? I recently actually just had a patient ask me, can I still keep getting lip fillers?
Never did research on that, but I thankfully I've not seen too many people with that. But I can imagine if they have it too much, it's definitely difficult to and they want to create that look, right? They want to look that pouty look. Right? So it's the open mouth posture look. So, and it looks sexy. All the posters, right? We have all those like like
like this. The short lip.
Yeah. So I mean, it's again, it's all this subliminal messaging that we are getting, and so how do you expect some children to react? They thought that was normal. So we just have to get to them and say no, shouldn't do it.
Before we go, I want us to talk about 2 different things. One of them, last thing I want you to talk about is about linguistic, because I know that you developed this tool, and before we go today, I want you to talk a little bit about that. But the last question that I have, it's about tongue up. Or, we always say that whenever children suck their thumb, they suck because whenever they're pressing on the spot, all of these amazing hormones and dopamine and whatever else is released, and it makes them feel good. So can you talk to us about, is there a cranial nerve that's over there that they are stimulating? Is that why it's important for the tongue to be up?
Yep. So to me, vagus, it's a vagal tone, right? So as mammals, we are very active. We need to run around. We can't really depend on. We really don't have enough energy to last long, right? If we keep on doing it, so we need a vagal break. So the vagal break really is to calm ourselves down, right? Take 5, if not take 50, right? So getting the tongue up is really one of the very key component where you you control your posture. You're holding your upper jaw well, extending your cervical zone. You're swallowing well, right? You're breathing well, right? And with that, right, obviously, if this is correct, then it is already primed in your whole circuitry system. right? If you get the tongue up, your whole posture is good, you're breathing calmly, swallowing 2,000 times a day.
I'll count.
Yeah, then you're healthy. You're calm. You're healthy, right? So that's why. So for most baby, if they can put a tongue up, then they put their tongue up to sleep. They're so calm. They're so quiet. They're so nice, right? Then you have the babies that cannot put a tongue up. They go, and you put them on their back. They go, help me! I can't breathe. Yeah. Then they were like, oh, are you hungry? Are you wet? Are you hungry?
I know.
Are you wet? Yeah, it's like, no, I'm not hungry. I'm not wet. I can't breathe. That's what they're trying to tell you, right? So then you carry them up when they're upright, right, and or over the shoulder or face down, right. Then they say, oh, they can breathe, and or they sleep on their tummy time, right?
Where were you?
Pardon?
Well, my kids were little.
Yeah.
Oh my goodness. Yes, so many moms have to deal with this. I mean, parents in general, yes.
Yeah, I think we can inform the parents early, right? Yeah, they know what to expect at least, right? So I think then it will be so much calmer for the whole family.
Definitely. I know that you have patients soon. You have to go. So tell us a little bit about the linguistic real quick.
Well, okay, it's a little cute invention. It came from the fact that you have to do tongue-tie releases at one stage, and then we were using Groove Director, a metal, appliance, and I have to give 2 to my IBCLC so that she can do her checks, and then finally she lost one, and she's like, frantic. She came over and asked for another one, and she took it. Right, and so like now I'm down to only two to do the surgery. I'm like, okay, I need to invent something that really can do the job. So I look at a tongue depressor. I was thinking, okay, if I can convert the other end, right? So because I was just thinking on a more holistic ground, where that next time when you check the throat by ENT, you should be checking the tongue, right? So you wouldn't just check both, right? So I came up, I called many people, and they don't want to entertain because I can't make that many, right? Thankfully, I have help of a Taiwanese friend, and we managed to go through a few rendition, and finally we got the linguistic out without the markings. So that one, yeah. So Rhonda is actually helping out with the distribution over in Myomed Easy. Myomed Easy. Over in US.
So is that how somebody's asking? How can they order these?
Yeah, we'll share the link, and then the next is of course Yuli. Again, myofunctional therapist over in UK. She's using it to actually do all kinds of training with the tongue as well, providing resistance. And the latest one we had improve on the model. Yeah, just like iPhone, we have now the iPhone Pro or the Linguistic Pro. Okay. So it comes in marking, so we can do ROM. You can put to the tongue. I can do deviation. I have the Cotlow index in there, so you actually can check the Cotlow index. And at the same time, also, we're getting some help from Dr. Zagi. He uses it for training for his courses. And at the same time, he's starting some research, and I will be helping out with the Brief Institute on this as well. And also, I'm talking to Dr. Umankan Katwa, Harvard pediatric pulmonologist as well. Wow. And he's looking into working with it and see how it can also help with the spread of the use.
Awesome. Amazing. I will post a link on our Airway Circle Facebook group. So whoever wants to order, you can go straight from the link.
And maybe one more point before I go off. I would like to really thank also Linda Donofrio. Right, I think she also did a fantastic job in setting up the whole group, and I feel I also learned a lot from interacting with her Facebook community. Right, so
definitely, I think they have 11,000 members all over the world. It's a great group.
There's of course Mark Moeller and Samantha Weaver. Also, they also did a fantastic job in coordinating worldwide effort, I would say, to get this going. So I think like we talk about, like we are the the group, right? I say when we want to save the world, I was watching the Falcon and the Winter Soldiers.
By yourself?
No, of course with my family. My son has watched it and he's like giving me all the spoilers before it happened. So
and they know it all.
But the most important thing is to realize, right? Superhero don't have it good. Yeah, I mean, Falcon also is like, he's still making ends meet, right? And the Winter Soldier has to manage his emotional issues, right? But the fact is that, right, whilst they're fighting this whole war for the world, right, we're still neither side, right? We're not with the good or with the bad totally, right? So that is tough. So that's why I feel that also what you're doing, setting up all this, the Airway Circle as well, right? Is like say it's the Justice League, like the Avengers, right? We have to come together. We have to support each other, and we continue to do our work together and learn from each other, and then we can really move this ahead.
I am so thankful. Yes, thank you for being here. Thank you for your time. I know it's early over there. You're ready to go to work. Thank you everybody for being here, that listen, that ask questions. If you stay a little bit longer or just going to our next live, we're going to be talking about Airway Circle a little bit. So just hop on the other one, and we have a lot of news and a lot of good stuff that you guys do not want to miss. Next week we have, let me see real quick. I have the schedule right here. Tuesday on Clubhouse, 8 p.m. Eastern Standard Time. We have Leslie Rubinoff. We're going to be talking about gut health. So the questions that we got about gut health right now, come to our Clubhouse on Tuesday, and they're going to be able to answer this. On Thursday, we have a surprise appearance by an incredible myofunctional therapist. I'm not going to tell you who it is. So you can take your guesses. And then on Friday, we're going to be talking about breathing. Also, you can take your guesses. I'm not going to tell you who it is until it gets closer. But that is it. Thank you guys for following the Airway Circle. Thank you for being part of the circle. Thank you for being here. You guys are awesome. Have a wonderful night. Thank you so much, Dr. Yu. And I'll see you soon. I'll see you on All right.
See you soon.
Bye-bye. Thank you, everybody.
Bye, everyone. Bye.